12:05 in the afternoon here on 90.3 FM. It's Wednesday. That means it's Helping Seniors of Brevard Day here on the radio. And here's your host, Joe Steckler. Hi, Joe.
Hi. Thank you, John. You know, listening to that music makes me think that something profound is about to happen. You know, it's this deep music, and while it's a little jivey and everything else, you think, gee, is somebody important going to come on and make a big, profound statement about what's going to happen with the national interest? Nah, all you're going to get is Kerry, Fink, Joe Steckler, and Lee Sheldon. You there, Lee? Lee's not on. Can you call him? Yeah. You don't have Lee's number? Okay. We're looking it up right now. So we'll get Dr. Sheldon on the show here, and if you're listening, Lee, call. So, but the purpose of helping seniors is to inform, educate, and help connect seniors and those that care for seniors with programs that will help them. And like a lot of you that are on this Christian network, a lot of you that listen to all this, you know that there's a lot that goes on in a living of life, and as we get older, we see more of those things. And Kerry, I'm not exactly sure how many years younger than me Kerry is. How many?
Let's see. You're how old?
85.
And I'm going to be 58.
Holy mackerel, that's a sin. That's a sin. He doesn't even know what pain is like, does he?
No.
You know, but seriously, all of those of you that are listening today that will hear the show, we're going to talk about the value of a professional staff, especially in caring for seniors. And Dr. Sheldon is going to talk about it from a dental viewpoint. He did a TV show on this, and it came out pretty darn good because it makes you think about what all can happen. But I know a lot of you, just like me, hurt. And right before we came on the air, United Healthcare had a great announcement, and they talked about beware of falls, beware of tripping in your house and hurting yourself. And I have to think about that, too. And anybody, that's probably Lee calling in right now. We woke him up. But having pain to contend with is something that is not a lot of fun. And those of you that are listening today, I really encourage you. We're going to get over a couple of things during the show, but one of the things that we'll talk about, I know what it was. United Healthcare talked about physical training to get your balance back and to help loosen your body up so you can move and everything. I'm going through that right now, and Kerry doesn't have to do that yet, but I do. And I'm also in something a lot of us, as we get older, rely on these little pills to get rid of the water in our bodies. And my cardiologist put me onto something called, and I'll say it'll be pretty close, the Lymphedema Clinic. And there's one over on Spyglass Road, and you're shaking your head like you know about it. You know?
Not that.
You were nodding. You weren't shaking.
No.
Oh, you were shaking. Okay, you weren't nodding. Okay. You on there, Lee?
I'm here, Joe.
Oh, great. We didn't wake you up, did we?
I'm not telling.
Tell me something. Did you forget?
No, I sent you an email yesterday. Did you forget?
No. I got your email sitting right here in front of me. I didn't know if you forgot to call in or not.
But no, it was, I get done with the patient and they say, oh my goodness, it's after 12, I got to call Joe. And that's where I was. Okay. All right. That's good. You know, Lee, you did an article for the Seniors Scene magazine and for our newsletter talking about the value of a dental staff member. But, you know, as I read what you put down and what you made in your comment, it could just as easily have titled the argue, The Value of Professional Staff.
correct?
I agree. I was thinking the same thing.
Yeah. So you've been in business a long time, and as a doctor and with the type of precision type work you do, it's extremely important to have good staff. So I'd like for you to just sort of take the lead this morning in talking about the staff, because Kerry and I are also going to talk about the raffle that was just completed, because I think it's important that people know how much we have improved in our own ability to do what we say we're going to do, and talk a little bit about what we might be offering for next year. And we've come to a big, step in our organization as to about how much do we want to broaden what we do, how much risk do we want to take. So there's so many things in running a nonprofit that are quite different from running a business such as you do. But if you didn't have a good professional staff, what the thunder would you do? Because what do you look for in a staff member?
Yeah, I was thinking about that as I wrote that, because I have never talked with you, nor have I ever written about the importance of staff. But as you know, I do consulting for other offices. And so let me talk to you about the staff member from hell. Is that okay?
Sure.
All right. So by the way, who else is on the air with us?
This is Kerry Fink. How are you, Dr. Sheldon?
Hi, Kerry. Good to talk to you.
Yeah, good.
At least he can understand what you're saying, Lee, if I can't.
Okay, that's good.
That's good. That's good.
To translate. That's good.
Okay. So if I don't make sense, Kerry, you jump in.
Will do.
So we're interviewing a potential new client who is in another state. So I'm not embarrassing anybody. The person is buying into a practice, actually bought into a practice, an existing practice, and is about to buy the rest of the practice. The dentist happens to be a female dentist. So the dentist already owns half the practice, and yet the front desk scheduler does not schedule any patients with this female dentist. So the female dentist asks her, how come you're not scheduling any patients with me? And essentially the staff member says, because I don't like you and blah, 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 blah. And she has to tolerate this because the senior doctor won't fire her because the state where she's in makes it difficult for you to fire people. So she confronts the staff member, and they have a staff meeting to clear the air. During this clearing the air session, the staff member berates the doctor publicly in front of all the other staff and the other doctor. They still can't fire her because of the rules of the state. And so now this doctor will be taking over the practice, and because she's taking over the practice 100%, the old corporation dissolves, the new corporation starts, and that way every staff member in the office has to be rehired, and of course this one won't be rehired. Can you imagine that? In the state of Florida, I can fire anybody I want. It's called a right to work state. It's really called a right to fire state. And I don't fire very readily, by the way. But here is state politics that essentially ties that person's hands so you can't fire that person. I mean, you can eventually fire that person, but there has to be a whole lot of documentation, which I'm sure, based on what I was, my conversation with that person, they didn't have. So, what do I look for in a good staff member? Well, first of all, why do you want a good staff member? As a patient, the reason you want a good staff member is because you want me, the doctor, to be relaxed and to be on top of my game. And if I'm thinking about everything else other than your treatment, other than your care, if I'm thinking about why isn't this person here today, or this person is disgruntled and what do I have to do to deal with her, or any of a number of negative events that can occur in any business or in any relationship anywhere, then I don't have my mind completely on your case. And if I don't have my mind completely on your case, then I may miss something or I may do something simply because I don't have 100% attention on you. That's what besides everything I wrote in that article. And I didn't put this in that article, but that's the reason you need good staff members. And by the way, patients, you need to be able to look and identify who good staff members are, because you want the happy, productive staff member in charge of your case. After all, you as the patient are interacting with the staff member before you interact with me, and you're interacting with a staff member after I leave the room. So you know who's good, and you know who isn't, and you want that person representing you as well as possible.
Well, you know, I've seen a large number of doctors, and Kerry, feel free to chime in with us, because, but I know that in dealing with cardiologists and internal medicine doctors, it's extremely important that the nurse understands the patient, because I think that the nurse finds out things about a patient, and like any good staff member would find out about a patient, that the doctor doesn't really have the time to find out. And you do a lot of joking or talking with the nurse, and those of you listeners that don't talk to your nurse when you go in for your medical checkup, you're making a huge mistake, because nurses many times are closer to the actual cause and effect relationship of a medical problem than sometimes a doctor is. The doctor has the training, and a doctor has the education more so than a nurse does, but that nurse sees so many different things. And now you're nodding your head, Kerry.
Well, I was just going to add, from the patient side, when you walk into an office, a medical office or a dental office, usually you're moving in with a great deal of apprehension. You're a little bit nervous about it, whatever. There's a tension in it. And I was just thinking, as you guys were talking about this, when you run into somebody who is not only bright and cheery, but genuinely interested in what your situation is and making sure that they communicate correctly to the doctor what's going on, that's an invaluable service that's part of the whole treatment process, because Lord knows we've all been around situations where you've been to some place and it's, okay, next, number 542, and you're not sure if even things are getting communicated up and down the line. And to me, as a person coming from the other side of the desk, it really seems so important that a doctor or medical practice or dental practice has a staff that really works and clicks together on that way.
Well, Dr. Sheldon, perhaps you could comment on this a little bit, because we have talked about opioids, and we haven't talked about medical pharmacies and all this stuff. And maybe our senior listeners need to know a little bit more about what we think and what a medical pharmacy is. And when you call your doctor's office and you tell the phone answerer that you need a prescription refill, these days getting the doctor to get that prescription over to Walgreens or at Walmart or wherever you go get your medicines refilled, I know from my military experience, it's becoming more and more complicated, because so many higher-ups are trying to regulate medicines. And I know, Dr. Sheldon, that you're a very strong believer in not over-medicating. And but what are your thoughts about how good trained staff can help a person relieve a lot of the stress and stuff that does in fact cause them to use a lot of these medications that they may not necessarily need?
I don't. As far as medications go, since it's not part of my practice, it's not something that I can talk to readily. Since the medications we refill are pain medications and antibiotics, and that's all we do. We don't have people on chronic medications. But I can tell you this: in and this is applicable. This would be applicable. It's not exactly applicable to your question, but certainly applicable to both the medical profession and the dental profession. In the dental profession, dental assistants are told, and dental hygienists are also told, you cannot diagnose a case. You can observe, but you cannot diagnose. And they graduate from school with that. You cannot diagnose. You're not allowed to diagnose. So a patient comes into my office, and what do you think I tell the assistant or the hygienist? I tell the assistant or hygienist, you better be able to diagnose. I don't care what they taught you at school. You better be thinking through the case from start to finish. Otherwise, how are you going to learn what I'm thinking, and how can you communicate with the patient? The longer the staff member is with me, the better the staff member can digest what's going on and can give the patient a good idea as to what's happening, which frees me up. It actually frees me up. So when a patient comes in for a new patient examination, the assistant is with the patient for about 30 or 40 minutes. During that time, the X-rays are taken and conversations had with the patient in order to be able to determine what the patient's needs are, and then the dental assistant comes up and briefs me for about 5 minutes before I go into the room. The dental assistant gives me her diagnosis, her thoughts on the case. Now, that doesn't mean I have to live with her thoughts. In fact, sometimes I do and sometimes I don't, but I'm making the decision myself. But by having a knowledgeable person, number one, then I go into the examination, and I either partially agree with her, partially disagree with her, completely disagree with her, totally agree with her, whatever it is. Then she has now taken the lead role, because now I'm speaking with the assistant, giving the assistant the authority to let the patient know what's going on. And the patient then has a lot more confidence in the assistant, has a lot more confidence in the hygienist, because that person is so much more knowledgeable. It's important because the longer a staff member is with me, the better the staff member is to be an extension of me. And if the staff member is an extension of me, it makes my role easier, and it gives the patient a knowledgeable person to talk with. Well, we don't always have to run and bother the doctor. Where the staff member is confident enough, the staff member can give a good answer. It doesn't mean it doesn't mean we isolate the patient away from me. That isn't the idea. But there's certain things that require my critical thinking skills, and certain things that don't. So your relationship that you have with your dental assistant or with your nurse can be extremely important in helping you with continuity of care when the doctor isn't around or when the doctor doesn't have a chance to call you back. So as a patient, I would establish that relationship with a staff member. I'd find somebody and say, hey, I want a relationship with you, because that's the person you're going to be communicating with in the future.
Kerry, I know that over the last couple of years you had to deal with some medical issues with your mother, and by virtue of the fact that you had taped some of these shows that Dr. Sheldon and I have done when we first were doing our marathon tapings, and we were taping 5 and 6 days a week, 5 and 6 shows a day, which was a lot of work. But we got a lot of shows taped, and we got a lot of information out on the network, which is still being shown, and most of this information still applies to the current day situation. I know that the knowledge that you gleaned from doing the television tapings helped you enormously as you helped your mother cope with some senior issue problems.
Yeah, no, that's completely correct, because I've often said that aging is sort of an on-the-job it's on-the-job training, because we're really not aware of what we're running into, and that's why things like what Helping Seniors does is so important, because it helps us move ahead or get an understanding or create the aging plan and things that help. And I think for most of us, maybe the place that we arrive at is we're the adult children of aging parents, and all of a sudden we're confronted with all these medical decisions and things that we really are not necessarily prepared for. However, having said that, by being around all these different TV programs, radio programs, the different informational aspects of Helping Seniors, we felt that we were significantly ahead of the curve, at least to be able to have some understanding of the questions that needed to be answered, as opposed to, I thought if we had hit this as a stone cold wall, maybe we weren't in a position where we were in the same town with our mothers, or in our case they actually live with us, but in that particular case, I could imagine if you're sitting in Chicago and now all of a sudden mom is ill and she's in Florida and you're trying to break away from your, brokerage business or whatever you do there, and you're trying to figure out how to best help mom, it's a difficult place to be. That's why the work of helping seniors is so important in all of this.
It doesn't make a difference. And for those of you that wonder about the importance of certain types of medicine to seniors as we grow older, I've asked Dr. Sheldon to have a column in our newsletter almost every month of production, and the reason is this. Dr. Sheldon writes about things that pertain to dentistry, but those of you that are reading the articles, if you pay close attention to what is written, you will see in general how what Dr. Sheldon writes about is something is applicable to almost every aspect of medicine.
Hey, Joe, I got a fact for you. You want to hear the fact?
Say it again, Lee.
He's got a fact for us.
I have a fact for you. I have a factoid.
Go for the fact.
Go for it.
Good. All right. When physicians go on strike, more people live. When nurses go on strike, more people die.
Wow, I would believe that. When doctors go on strike, more people live, and when nurses go on strike, more people die.
That's right.
Wow.
Where did you get that, Lee?
I forgot, but the one about doctors that went to the New York strike. There was a strike by physicians, by New York physicians. I believe it was in the 70s or 80s, and so they looked at the stats because the physicians were on strike for like 2 or 3 weeks. I forgot where the nurses stat came from, but that was a more recent stat.
Wow.
Well, what you just said is so important to everybody as we get older. Sometimes it's harder to maintain a sense of levity, and I know that once we fail to recognize some lighter moments in our life, it gets more difficult to cope with some of the problems that seniors have to deal with. And we got about 2 minutes before we take our mid-show break, but Lee, when I was a commanding officer of the Navy home, I had a senior captain dentist there, and he was a single dentist that took care of 550 seniors.
Wow. And
he believed, and he told me, he said, why tear a person's mouth up at 95 when I can do some simple things that will make them comfortable? Mm-hmm. Yet at the same time, he said, if I see a problem that really does need to be addressed with more than routine care, we certainly do that. Does that make sense?
Yeah, it does. I mean, listen, it's all quality of life issues. If you've got somebody who's 95 or 98 years old and they're comfortable, then all I'm trying to do is to keep things going. I'm not going to do major crown and bridge work and things like that. At the same time, I had my oldest dental implant patient was 98 years old.
Wow.
And she couldn't chew anymore, and she wanted to be able to chew. So what do you think I did? I gave her dental implants, and she lived the next 3 years, and she was able to chew again. So, it's all judgment. You don't have to do work. The only thing you have to do is keep people out of pain and get rid of their infections. The rest of it is elective, and it's a judgment call, and that's based on good conversation between the doctor and the patient, or the doctor, the staff, and the patient.
Okay, I'm going to give you my factoid before we take our break, and I won't give you a chance to come back on me unless you do it in the aftermath here. I like a beef O'Brady hamburger better than that one you and I used to talk about that would last a long time. Remember that?
No.
Okay, all right. Take the break, John. Don't give him a chance.
12:34 in the afternoon here on 90.3 FM. It's Wednesday, Joe Steckler Day, helping seniors of Brevard. And once again, here is your host, Joe Steckler.
Thank you, John, and welcome back to the second half of the show, folks. You know, every Wednesday at some point in the show, I hope I remind people to remember that we're trying to build a Talk to Me radio network, and we need you to participate in what we're doing. Our office number is area code 321-473-7770, and if you got questions, if you want to know what's happening, you need to give us a call. Tell us what you don't think we need. Tell us what you think we need to do that we're not doing. At the same time, remember that we are a nonprofit, and
it's pretty accurate, you know.
That we are a nonprofit, and that we need your support. We just finished our car raffle, and it was very, very successful. In fact, I already received an email from Mark Pylock, the owner of the American Muscle Car Museum, where he has booked almost the same weekend for us in 2020. He likes what we do. He likes how hard we work to make a car raffle successful in order to support people. And I apologize to you that may have called the office in the last 2 weeks and not gotten a quick response that you normally would get, but we were really, really, really snowed under with phone calls. In 1 week, I answered over 300 phone calls myself. So that should tell you the interest of your interest in our raffle, wanting to help us, and at the same time talking about the needs in the community. And Dr. Sheldon, I just pulled up the brand new issue of Senior Scene magazine, 12,000 of which just hit the street last week. And they're all over 500 locations throughout Brevard County. And I'm finding more and more people are calling us because they read Senior Scene magazine. And I would encourage people to get this special issue of Senior Scene magazine because I liked the column you wrote in there, and the title was, "Why Does It Cost So Much?" And you talked about cost of dentistry and people having to make decisions. Years ago, we made a decision as to whether or not the hospital would deliver the baby and take care of the wife for a day or so, and the cost was $75.
Wow.
I remember that. My brother's wife's first baby was born in the hospital, and his hospital bill was $75. And that wasn't back in the 1800s either. It was actually it was in the 1900s. But things change. Costs change. Services change. The type of things we offer people change. We can get certain things free, cheap, moderately priced, or we can pay more and have it. And while you and I have talked about the cost of dental care, we have never on our radio or television show talked about the cost that women undergo in having eyelashes applied like a tattoo type thing. We never talked about eyeliner, eyebrows, all this kind of stuff that you can go to a facial expert and that's not cheap. I don't know the cost of it, but I know that it's not like going to McDonald's. I know that. And you're paying a lot of money for it. But the essence of what you had in that article was pretty darn good about people making a realistic decision on what they wanted to do with dental care as opposed to medical care, and how they're paid for differently, and why this has happened. Do you remember writing that, Lee?
Yes, I do, and it's a topic that's on my mind, because in dental care you can elect to do whatever you want to do. Dental care unless you talk about infections or pain, dental care is very much like going to the plastic surgeon. Well, plastic surgery isn't paid for by insurance. It's an elective type of thing. It's, I want to smile better, I want to chew better. That's what dentistry is all about. Well, I want to is a whole lot different from I have to.
One of the things I was thinking when I was looking at the senior scene, this issue with the title of the article that you had in the column there, why does it cost so much? And by the way, listener, if you get a chance, make sure you pick up the May edition of Senior Scene and look for those yellow. We call them the yellow pages, but it's the actually now it's 12 pages in the center of every edition of Senior Scene. That's the Helping Seniors newsletter plus the Helping Seniors directory. But my point about the article was this ties in so well to the topic of today's radio show, because you wrote in here, what do the solutions that we provide take? It takes study, it takes hiring and training the best staff. It requires continuing education for our doctors with the best teachers in the nation, and it takes an investment in technology. And I was thinking this ties back to the whole discussion that you and Joe were having in the first part of the show, where you're talking about why it's so important and how the medical staff adds so much to the equation. Well, someplace in there that adds to the cost of the equation too.
Sure it does. Yeah. And you'll see this. You'll see this any place. I mean, you'll see this in any profession, not just in the dental profession, not just the medical profession. There are different levels of services that anybody wants. I mean, some people will build a standard 3-bedroom, 2-bath house. Others will build a fancier house with a pool and that type of thing. But what's the difference? Well, the difference is how much labor, how much design, how much thought goes into the process in order to be able to give you the final result. In dentistry, we have emergency clinics around the state. I mean, around the state, also around the county. So that if you have a particular need, a single need, you need a tooth extracted, you need something that's just needs to get out of the emergency, well, that's where you go. You don't go to somebody like me. Somebody like me, I'm there to do upper-end cases. I'm there to take somebody who's badly diseased or badly debilitated and get them to the point where they're chewing and they're chewing comfortably again. Different level of service. You wouldn't expect me to provide an emergency clinic. I mean, I'll do emergencies, of course, on my own patients, but hopefully I've done it right so we have very few emergencies on our own patients. And so you have to select the level of care that you want. So when somebody comes to me, well, why are dental implants so expensive? It's very difficult for me to answer that question in one single, one-sentence answer. Essentially, you'd have to climb into my books. You'd have to climb into the amount of training I have. You'd have to climb into the expenses for staff and the technology and all of the things that we bought in order to be able to deliver the services that we do. And then 5 days later, say, oh, now I see why it costs so much. Essentially, it costs so much because it needs to cost that much in order for me to deliver the service the way it needs to be delivered. And both of you, I don't think I'm giving away secrets, both of you have had the opportunity of being in my office, so yes. You kind of see it.
Yes.
Well, Lee, one thing that we hit and miss on this thing every time you and I talk about dentistry on the radio, and you never really write about it in the magazine, but you have a program that you give a consultation free as long as somebody makes a very minimal donation to a charity. And for that donation, you send the money to the charity, which has generated several $100,000 worth of assistance to nonprofit organizations over the years. But more important, a person can come in and you will do a complete set of x-rays of their teeth, and you can see the problems that they really, truly have, and you have a picture of what you can show them as to what is happening or going to happen unless they take certain types of preventative action. You can then lay out a plan and a good ballpark cost of what they might have to pay for this type of thing should they want it. And it's like somebody going to some of these places, but it's not more. But I don't mean to degenerate or denigrate what you do to help take care of a person's care. But when we talk about elective surgery, and we talk about people going and getting eyebrows put on, or eyelids, or lipstick, the permanent texture of the lips, or whatever it is to have to do with cosmetics, or get liposuction done instead of just going on a diet, and we do all these things, we pay a lot of money. That is one industry that nobody ever puts a price tag on. And we see a lot more doctors doing this, especially doctors in larger cities where they have very, very, very large and expensive practices in huge clinic-type settings. Yet at the same time, you offer people an examination where you can actually show them what they really might need to do if they want to take care of a problem or whatever it is they might want. And let's talk for just a second about, I've read something recently about dangers of teeth whitening. Have you heard anything about that?
No, I mean, the dangers of teeth whitening, the only thing I know about is sensitivity. Are you talking about the constant exposure and that it could cause oral cancer? Because some people do say that. I haven't seen any data, but I've heard that.
No, okay. I will see if I can find the article. Then we can talk about it on another show. But it really got my attention very quickly because I was thinking about asking you about doing a whitening process of my own teeth. And when I saw that article, I said, I got to ask Lee about that. And it's just like being informed about any kind of a treatment we do on our body. We need to talk to, I'm going to say, a specialist in that area. You are a specialist in the area of the mouth, and you can help people understand what it is that they might need to do if they want to make certain decisions according to what they have a capability to do.
It's true, and there are, and by being a specialist, that means that we're trained 3 years beyond dental school for the most part, and then there's attention to detail on advanced cases, and particularly with us, it's periodontal disease and dental implants. So, yes, I mean the training and background is very important when you're making a decision on who you see. And we just have to make sure that we know who we're seeing. If your patient has periodontal disease, well, should the periodontist be the one who's looking at that patient to verify that, in fact, periodontal disease is present or not, and what the treatment is that needs to be done? And that's near and dear to my heart, as I just got a text from a very close relative of mine who says her husband needs a great deal of periodontal treatment. And I just saw her husband probably 3 years ago, and he needed no periodontal treatment then. He's well in his 70s, and I'm trying to understand what happened. So now he is going to come to see me for a second opinion because I have my doubts.
So yeah, fair. That's also goes back to the value of having an expert help on these things, because if you don't, if somebody tells you something like you have periodontal disease and you're not sure, it's good to be able to go to that expert. And it kind of rolls back to everything you wrote about in the article in this month's Senior Scene, I think.
It's true. You look at it, Kerry, and you say, all right, I'm going to the expert. It's always going to cost you more money. Well, For the procedure, it may, but I can't tell you how many times I see a person for a treatment and say, hey, we can do it a lot more simply than this, and they end up saving money rather than spending money. Or the number of teeth that need to be extracted. I had one patient come in yesterday. She was told she needs 4 teeth extracted. Well, she only possibly needs 1 tooth extracted, and even then, that one we're going to make a pretty good attempt to try to save it. So, I mean, we're going from 4 extractions down to potentially 0 extractions. That can be pretty significant. That is, by the way, the reason you see a periodontist. Sometimes we jump too fast, and I wrote an article about that a few months ago. Are we extracting too many teeth?
Yes.
And you and I talked about it on the air, Joe. And the answer is yes, we're extracting too many teeth. We are. We're extracting teeth that could be saved because we think that dental implants are a better solution. And the answer is, the longer we're doing dental implants, the more we're deciding, those of us who are in the profession are deciding, hey, maybe dental implants aren't the only answer. Maybe we'd be better off saving the teeth.
Well, I truly agree. And the one thing that we have never really ever talked about on our show lately, and we've never really discussed, and since this is really a show about senior citizens and the problems that seniors have, as we get older, the darn teeth get more, they fracture more easily, they break, they come apart, we put crowns on them and they disintegrate underneath the crown, the crowns come off, and there gets to be a point where there's only so much you can do in the area of preventative or maintenance dentistry, and I just wonder what people should actually be doing. So.
Well, I mean, if you're going in, if you're having regular problems like that, something is being missed. It isn't just that the body is deteriorating. If you have crowns that continually fall off and things like that, something is being missed. You really need to get another opinion, because that isn't ordinary dentistry. It doesn't work that way in my office. Why should it work that way anyplace else?
Okay. We're going to talk about something completely different from dentistry. Lee, if I ask you, would you be more willing to buy a ticket on, say, a Dodge Ram truck, a Charger, or a Challenger, or a Miata convertible, or maybe a Silverado truck, or would you be more inclined to want to buy tickets on a 2020 Corvette? What would your answer be?
I wouldn't want to take the care of the Corvette. See, that one's out.
The Corvette's out?
Yeah, me and a Corvette and all the things that could happen to the Corvette. Nah, I don't. Listen, I want a car that's going to get me there. So, I mean, I've got my Japanese car that's made in the United States. I won't give any brands. And I've got 105,000 miles on it now, and I'm looking to keep 200 to maybe run it into the ground at 200,000 miles. That's the kind of car I want. What kind of car do you have that's like that?
I'm going to ask Eleanor what she would like to have. I'm going to ask Eleanor.
Did I ruin your whole segment?
I bet Eleanor would say she wants a Corvette and you can have what you want, and she wants to drive something that's stylish.
Yeah, maybe right.
You blew my.
Eleanor drives an SUV.
You blew my mind. Anyway, we're trying.
Oh, Joe, I really want the Corvette.
Oh, thanks, Lee. Thanks, Lee. Now,
Love it.
Now you come on, folks. Whether it be talk radio or whether it be a TV show, I don't care what it is. If you've got guests and you got people on the show that can take a moment to reflect on how to make life lighter, life easier, make life more meaningful, we need to think about doing that. One of the things I don't think I've ever talked about this on the radio. Maybe I have with you, Lee, but when years ago when Temple Beth Shalom gave me the award of the Oh, gosh, I can't.
It was the Crown of the Good Name Award.
The Crown of the Good Name Award. I was the only non-Jewish person, I think, that had ever received that.
Wow.
Correct?
That's correct.
Wow.
And it's something that I have in my study at home, and I treasure that because I did a lot of reflecting, and I make a lot of mistakes in what I do, but I think generally speaking, I try to work with people to bring out the best in all we can, whether it be general medicine, dentistry, assisted living programs for people that need help, getting families to understand how they can work together. And I worry greatly about Brevard County, Florida, because we have so many senior citizens here. And I know the guy sitting in the studio with me this morning, Kerry Fink, has come to realize a lot more about what we do since he's been involved. Kerry, I'd just like for you to go and take a minute and talk about why you think the car raffle, the work we do at helping seniors, why it's important and why it needs to continue.
Well, the flippant answer is the car raffle was just a lot of fun. I mean, there was 2,000 people out there. There was so much excitement. And yet underneath it all, everybody understood that this is for a very worthy cause. We live in this county that where 1 in 4 people is over the age of 65 and 1 in 2 is over 50. And that means that a lot of us are getting older. We were joking at the start of the show about our age difference, but give me a few years and I will catch up. And Lord knows, I hope that the things that you have taught along the way with through helping seniors of Brevard. I mean, this is why the outreach is so important. People read. We live in a county that is 70 miles north to south. We joke Micco to Mims, and getting this information in the hands of seniors so that they can really affect an aging plan is so important. And then not only that, the people who call the Senior Information Helpline, which is our main service to the community, we are the Senior Information Helpline. People call us, and they are literally, I hear the calls when they come in, and I know what you go through in terms of trying to find ways to help these people. But it's everything. It's everything from housing, financial, legal, medical. What do I do next about this situation? And if I can only imagine, we've helped 2,400 or some odd families since you founded this organization in 2011. That's an important work. None of those people have had to pay for it. The only reason that we're able to exist, we don't get the government grants, but it's because we have good business sponsors who get behind the organization and the people who are kind enough to help support us in the Helping Seniors Car Raffle. But it's so important because as we get older, we need to have this information so that we aren't as surprised as we otherwise would be.
Right. We need to be able to make informed decisions, whether it be about dental care that Dr. Sheldon talks about, whether it needs to be about a Talk to Me radio network, which we were trying to establish here on 90.3. And it can be done, but it can only be done if we have people that participate and people that listen. And we've got about a minute left, and I just want to say one thing, and then I'll let Lee close the show out today from his office. I do thank all of you that have helped us with fundraising over the years, because without your support, there's no way we could have done what we have been able to do. And it is a mark of a community that wants to work together, pull together, learn together, and live together. And that's so important as the world changes. Well, Lee, I gave you a fib. I ran out of time, but I do want to say thank you, Dr. Sheldon, for being on the show. Thank you, Kerry Fink.
Sure.
And thank you, listeners, for being with us. We'll see you next week. Bye-bye.